Dear Chair, dear audience, in the next few minutes I would like to present my progress of 6 months. And first, I would like to introduce my PhD topic, which is the inflammatory processes of the urinary tract and its association with genitourinary cancers. My name is Róbert Vass. I am a first-year PhD student and a resident doctor at the Department of Urology, Semmelweis University. And my and our team's vision is to reduce the incidence of genitourinary cancers, and we want to achieve this in identifying risk factors for genitourinary cancers. So here are the two projects which we have started last year. They are both discussing the relationship of bacteria and the bladder, albeit in a different plane or different level. So in the next few slides, I would like to go into more detail discussing them. Our first project is investigating the effect of lower urinary tract infections on the incidence rate of bladder cancer in women. As we know, bladder cancer is the 16th most common cancer in women worldwide, and to put that number into perspective, this means that 1 in 89 women will eventually develop bladder cancer. And while the incidence of bladder cancer is considerably higher in men, women do tend to present with a more advanced disease at the time of diagnosis. Several risk factors have been well documented in the case of bladder cancer, and they can be grouped into non-modifiable and modifiable groups. Of the modifiable risk factors, smoking accounts for the most number of preventable cases, but also there is the infection caused by the blood fluke schistosoma hematobium, known as schistosomiasis, which also increases the risk of developing bladder cancer. Beyond that, bacterial urinary tract infections, there is also some evidence that they are a modifiable risk factor for bladder cancer. And this last statement carries a huge weight to it, because 50 to 60% of women will have at least one UTI during their life. 20 to 30% of those women will develop recurrent UTIs, putting the total number of women worldwide who will ever in their life have a recurrent UTI up to 400 million. So for this reason, it is imperative to answer the question, do frequent lower urinary tract infections increase the incidence of bladder cancer in women? So our population of interest would be adult women, and we would like to compare the rates of bladder cancer in women exposed to UTIs compared to the rates in women not exposed to UTIs. We hypothesize that frequent lower UTIs increase the odds of developing bladder cancer in women, and based on the results, whether they are significant and their magnitude, the implication for clinical practice could be that women with a very high number of lower UTIs could be followed more closely for an earlier detection of bladder cancer. So we conducted our systematic search with the shown search key in PubMed, Embase, Cochrane Library, and Web of Science, and we have acquired a little over 15,000 results, which after the process of duplicate removal and title and abstract selection and full text selection have netted us 10 eligible full texts. We also try to identify relevant articles via citation and reference chasing, but we haven't found any this way. So to summarize the progress of our first project, we are past the stage of data extraction, and we are currently working on the risk of bias assessment, and also we are constructing our figures and tables as I speak. So the second project is comparing the composition of the urinary microbiome in bladder cancer patients and healthy individuals, also a systematic review and meta-analysis. So dysbiosis is a disruption to the microbiome which results in an imbalance in the microbiota. And this term, dysbiosis, in the last decade or last 2 decades has been linked to a multitude of diseases ranging from metabolic diseases to cancers. And while there is evidence linking dysbiosis and diseases, causality is a huge topic of debate as most studies, due to financial reasons, could only be conducted in a cross-sectional design. But there are animal studies, longitudinal animal studies, which suggest that certain bacteria promote oncogenesis while others are protective. So, given that we know that there are certain bacteria which promote oncogenesis, and there are some which are protective, we feel that it is important to ask this question for the case of bladder cancer as well, in the case of the urinary microbiome. So our question is there a difference in the composition of the urinary microbiome in bladder cancer patients and healthy individuals? Our population of interest would be adults, and we would like to compare the microbial composition via relative abundance and alpha diversity indices in bladder cancer patients and non-bladder cancer patients. We hypothesize that bladder cancer patients' urinary microbiome is less diverse compared to healthy individuals. And again, based on the results, whether they're significant and the magnitude of the results, the implications of this study could be twofold. For the research field, for the scientific field, it could pave the way for longitudinal studies to determine an actual causality between the microbial changes and bladder cancer, while in the future, far future clinical setting, it could potentially be used as a biomarker. As of now, this project is still in the preliminary phases. We have a preliminary search key with preliminary results. There is a previous meta-analysis, but I believe it is more accurate to call it a pooled analysis. It is not a systematic review. The authors cherry-picked, so to speak, a few articles and pooled them together, and there is no current Prospero registration on this topic. Here I would like to show 3 articles which we deem comparable enough in their population and also the outcome and outcome parameters which we aim to pool together. So to summarize, we have 2 projects discussing a very similar things, the relationship of bacteria and the bladder, and we aim to finish these this year fall. So I would like to end the presentation with a quote from Confucius, that the man who asks a question is a fool for a minute, the man who does not ask is a fool for life. So I encourage everyone to ask questions. Thank you for your kind attention.
Thank you. It was a nice presentation. And I was wondering about, for the second project, your population is about adults.
Yes.
And have you made any preliminary research that, according to countries, or about how will you manage these subgroups, about the regions? Do you know anything about it?
So, as of yet, I am not aware of any significant differences regarding the geographical differences from the existing studies, which are mostly, I think, Germany, US, and Western countries. So my personal opinion is that there would definitely be differences if other countries of other continents would also be conducting similar research. But yes, I am not aware of any significant differences as of now.
Okay, thank you.
Presentation. My question is to your first project. I was wondering how you would define the frequent UTIs. What's the threshold between not frequent and frequent?
Yes, so as of now, the way we define it is to group patients into two categories. That would be low exposure and high exposure patients. This is sadly probably the available data allows us to do in grouping. So because most articles don't actually define what they mean by recurrent UTIs, I don't believe that we can use this definition which is used in the guidelines. So that is why we use this word frequent to account for this discrepancy.
Yeah, okay, thank you.
I have also a question to this point. Why this is a subjective factor in this case? No, why the recurrent urinary tract infection has a clear definition?
Yes.
2 infection per half year or 3 infection per year. In this case, if we cannot give a objective definition, can we use it in the study?
Yes, that is why in the protocol we omitted the word recurrent urinary tract infections and rather used this word frequent as to not transgress any existing definitions.
Okay.
Yes.
And I have another question to the first topic. Did you, which type of the bladder tumor, the histological type, did you investigate in this study? Only the ureterial cancer or the squamous cell cancer?
So our main outcome is overall, so any type of bladder cancer. But we also wrote this in the protocol that we would like to subgroup different histologic subtypes. So we would have been really interested in urothelial alone and squamous cell carcinoma alone. Sadly, we don't have any data to perform separate analyses for this. So what we will have is merely an overall bladder cancer group.
Hello. I was wondering if you are looking from the perspective of hormones for UTIs and bladder cancer, because as I'm aware of, it will be different.
We haven't considered hormones for the first project, and as I am aware, there was not really any discussion in the original studies regarding hormonal changes, or what exactly do you mean by
for example, the age of the patients. If a woman is menopausal, it's a high risk of blood cancer. The risk is higher. So what's the definition of your population exactly?
So the definition is women aged 18 and above years. Okay. The original studies, of course, conducted multivariate analyses where age is included in those analyses, but yes, that is the extent of the consideration for this.
Yeah, okay, thank you.
Thank you for the nice presentation. I have a question that you were only examining the UTI as it is, as a fact, if it's there, or you were also, or could you, or would you be able to check for the pathogens which are included, because they can be quite different also. So it's to take them under coverage.
Yes, so that would be really interesting, and it would have been it was our first impulse to check by the different pathogens, but there is no literature on this. So what we have is just UTI or no UTI. Sadly, there is no mention of the exact pathogens. And it is understandable, because for a diagnosis of a non-complicated UTI, a urine culture is not required. So for this reason, it is not really feasible or possible to acquire this data.
So I was also wondering about the pathogens and also the resistance of these pathogens, but maybe it's easier to find data, but I don't know if it's mentioned in the publications, the data about the antibiotic intake or treatment, how often these patients get maybe?
Yes, so this is another very good point that treating a UTI and not treating a UTI would definitely have a different outcome in terms of carcinogenesis, but there is no data on untreated UTIs, so it cannot be compared. All the articles which we have are, I believe, all discussing UTIs that have been treated accordingly with antibiotics.
Okay, thank you.